So there are certain conditions in which the ratio of the RBC or blood cells goes up and the plasma level goes down. So when the concentration of RBC goes up, then hematocrit goes up. We call it dense blood. We call it concentrated blood. We call it concentrated blood. And when the concentrated blood is increased, so then we call it concentration increase, then increase the viscosity. Viscosity increase means thickness is increased. Thickness of the blood is increased. When the thickness of the blood is increased, it causes increased resistance. Okay, when the resistance is increased, then increase loss of energy. Increase loss of energy because it has to overcome the energy resistance. It has to overcome the resistance. It has no enough energy. So loss of energy, so decrease flow. Okay, flow will be decreased. Keep that in mind. The flow will be less. Flow means how much. And when the resistance is increased, then there will be, I can do here, increased velocity. Velocity means how fast. So velocity will be increased because of the increased hematocrits. But the energy will be lost quickly. Ultimately the flow will be less. That's why excessive RBC, known as polycythemia. Polycythemia, dehydration, cause increased viscosity. And increased viscosity causes increased resistance, and increased resistance will cause increased velocity, but too much viscosity will cause decreased flow. Decreased flow and decreased pressure. Okay? So now, increased viscosity, increased resistance will cause increased velocity, decreased flow, and when there is a decreased flow, means amount of blood will be less, so the pressure will be less, because the less blood is coming because of the increased loss of energy. The blood will not flow adequately. Okay, so this is hematocrits, and also you need to know the polycythemia, dehydration, and it causes increased blood cells. So now in the contrary, in the opposite case, when the hematocrit ratio is decreased. When the hematocrit ratio is decreased, so then what happens? The plasma will go up. So blood will be more diluted. Okay, so now when plasma is increased and RBC is decreased, we call decreased hematocrit. We call decreased hematocrit. Decreased hematocrit means diluted blood. Diluted blood, when the blood is diluted, so increase the dilution, decrease the viscosity. Decrease the viscosity means decrease the resistance. Decrease the resistance, so decrease the velocity. Velocity will be decreased, the flow will be increased. Okay, the flow will be increased, but the velocity will be decreased because the resistance is decreased, because the viscosity is low. Okay, so now in any condition, if you see the fetal velocity, intracranial arterial velocity is increased, then you have to understand the resistance is increased. And who can cause the resistance? Yes, high viscosity can cause increased resistance. And hematocrit ratio, when it is greater than the normal, so there is a chance of increased resistance followed by increased velocity in the MCA. Okay, so that's all for today, and next I will give you a couple of other things. That is, we'll discuss the differences between the stenosis and the vasospasm and arteriovenous malformations, cerebral circulatory arrest, and the collateral flow. Okay, so and couple of more things we'll discuss. So that's all for today. So I hope these are very helpful of critical thinking. So I hope you are enjoying this lecture. Okay, thank you very much. Bye.